Hmm. Hello everyone. So NEET-PG 2024 done. Hope you all done with your best effort. Okay. So it's time to recollect the pediatrics question. Pediatrics recall. Yes, myself Dr. Sanjay Khatri on Medway platform. Yes, there are few good pediatric questions. Yeah, most of them are from our notes. Yes, one question is there which we never discuss, but I will discuss all the things together. Here we come. So as I told in my repeated class, last 5 year, 4 year, you get a question on pyloric stenosis. Again, it is pyloric stenosis. So the question, 6-way neonate, repeated non-bilious vomiting. Neonate non-bilious vomiting. We have only one answer. That is pyloric stenosis. Idiopathic hypertrophic pyloric stenosis. And USG picture is seen. USG, you can see target sign, antral nipple sign, or cervix sign. Yes, radiology people will very well discuss with you all those signs. Yes, but the thing is that in USG, pyloric wall thickness increase, more than 4 millimeter, and pyloric canal length is more than 16 millimeter. Yes, we need sonography picture in this? Probably not. 6-week neonate repeated non-bilious vomiting. What is the diagnosis? Yes, it is idiopathic hypertrophic pyloric stenosis. Yes, if USG finding is given, you can very well interpret cervix sign or target sign in this. Okay, the basic is pyloric wall thickness more than 4 and pyloric canal length more than 16. Again, I don't know why they are asking this question again and again. 2-year-old boy in pediatric OPD with growth retardation. Child found to have significant hepatosplenomegaly, anemia, and bone pain. It may be leukemia, but see the classical finding. Marrow examination revealed. Marrow examination revealed macrophage but look like crumpled tissue paper appearance. My friend, what do you want? Crumpled tissue paper appearance of macrophage. Yes, it is Gaucher. It is Gaucher. But they are not asking what is the disease. They want to know which enzyme deficiency is there in Gaucher. Yes, beta glucocerebrosidase. You should remember this enzyme, na? Because last to last year they asked this is the condition Tay-Sachs, but they want to know which enzyme deficiency is there in Tay-Sachs. So hexaminodase A in Tay-Sachs, sphingomyelinase in Niemann-Pick. Glucose 6-phosphatase. Yes, von Greeke disease. And beta glucocerebrosidase, which is our question, in Gaucher disease. Yes, you should remember, I am telling all these things because few are there who will appear in NEET-PG next year. Yes, few new students are there, or it's time because it's prepare you for next exam. You need to remember, sometimes they ask the question, but they don't want what, they don't ask what is the disease. They ask which enzyme deficiency is responsible for this. They are previous year they asked a child 7 month lose neck control is not there, exaggerated startle response, cherry red spot in eye. This is due to deficiency of. They are not asking it's Tay-Sachs. They are asking this disease is due to the deficiency of hexaminodase A. So here they don't ask it's Gaucher. They ask it is due to deficiency of beta glucocerebrosidase. Yes, for Gaucher, I tell you, just remember the mnemonic HOB. H means hematological problem, anemia and thrombocytopenia. O means organomegaly, hepatosplenomegaly. And B for bone pain, or sometime you get bone fracture. This is Gaucher's for you. Again. Simple question. We discussed so many times this question. Child presented with following deformity. Child presented with following deformity. What this deformity is? Wind swept deformity. One leg in valgus, another in varus. Yes, this is classically present in rickets. But which rickets? Type 1 dependent, type 2 dependent, hypophosphatemic rickets. Yes, lab investigation will help us. Serum calcium normal. PTH normal. Phosphate low. Should I go further? No, you are all intelligent. Low phosphorus with normal PTH. This is hypophosphatemic rickets. It is hypophosphatemic rickets. In CRF, phosphate is high. Type 1 and type 2, PTH is high. But PTH normal, PTH normal, PTH normal. I told so many times in my class, PTH normal, phosphate decrease. This is hypophosphatemic rickets. We discuss in detail rickets, everything about its treatment, its etiology, its type. But yes, if PTH is normal, phosphate is low, hypophosphatemic rickets, vitamin D resistant ricket, yes, this is, and more bony problems are more there, dental problems are more there, but calcium is slightly low or normal in hypophosphatemic rickets. I hope you not feel any problem answering in this question. Rickets, Gaucher, pyloric stenosis. 3 out of 3. Very easy question. Pyloric stenosis, Gaucher's disease, hypophosphatemic rickets. I am doubt because only 2 students telling me that this is the question. This was question this year FMG. Whether it is there in NEET-PG, yes or no, I don't know. But yes, we should know. Single bubble is there. It's classical of pyloric stenosis. Single bubble. If there is a double bubble sign, that is duodenal atresia. Triple bubble sign, that is jejunal atresia. Triple bubble sign, they asked this time in FMGE 24. Triple bubble. This question was there, or because they are answering na single bubble is seen. They are asking double bubble, then it's duodenal atresia. Triple bubble is jejunal atresia. These are few prototype questions coming here and there since last 2 years. Yeah, this is again a repeat question. I am discussing this question in recall session 3rd time. This image, probably this is the beauty of when you do the image based question or previous year question. Yes, what is the defect? You can see bladder extrophy. This defect present in 1/10,000 to 50,000 live birth. It's extremely rare. Bladder come from anterior abdominal wall. This is also known as ectopic vesicle. Clear picture. Clear picture. It's not umbilical hernia. It's not omphalocele. You can see bladder come above the anterior abdominal wall. It's a classical image based question. Yes, Chota doctor, you are right. Now. I need your help because I am not getting that chart is there, but I am not getting growth chart of 3 children plotted. But I am not seeing the plot. Where they? Suppose they plot here. From 0 to -1, it is mild malnutrition. From -1 to -2, moderate. But below -3, it's severe. So you should know the concept. If graph is there, your meeting point is coming between -1 to -2. It is mild. From -2 to -3, it is moderate. And if it is below -3, then severe malnutrition. So this is the thing. But the My limitation is this, that I am not getting the correct, or I can plot myself. Suppose one dot is here. This is C. So C is severely malnourished. One is here. That is B. So B is moderately malnourished. And one is here. So this may be the normal. A may be the normal. So I don't know where is the plot is there, but you know the concept. If it is below -3, severe malnutrition. From -2 to -3, moderate malnutrition. -1 to -2, mild malnutrition. So yes, this is weight, age. I don't know whether it's a weight for age or weight for height. But this is the basic concept. We have discussed in our class so many times growth chart. I always tell you, you should know the concept. It's as simple as a 6th standard student can plot. Here is the weight, here is the age. Here is the weight, here is the height. You need to interpret what is given, where your meeting point is, whether below -3 or above -3. That's simple, simple. Yeah, I totally accept this is a new thing for me because we never discuss this thing in our class. It is given on the second page of the ghai. Yes, these are the growth curve, but this was they asked in this NEET-PG. I delight, but accept we have not, never discussed this. But it's very simple, na? If you made little bit logic, na, this is the growth curve of brain. Maximum 90% of the brain growth occur within 2 years. See, our head circumference at 1 year, it attains 60 to 70% of adult size. Brain growth, head growth, maximum occur in first 2 years. Have you seen any child head circumference increase from 10 year to 50 year? No, na? No. So this is the maximum. Early rise, this is brain growth. Yeah, after 10 year, rise is there. It is gonads. It is gonad. This indicate somatic growth, which correlate with muscle mass. See, initial 1 or 2 year weight increase very rapidly. Then they are constantly increasing, but yeah, little bit flat. And then again at the time of puberty, rapid growth occur. So this indicate somatic growth. Somatic. And last one. Anybody in the comment box? Last one. It is the growth of lymphoid tissue. Which generally increase because of tonsil 5-6 year, and that is indicated in our curve. I admit I never discussed this in my any of the class. Okay, growth curve, but it's very simple. Growth curve, this first A indicate to the A growth curve for indicate brain growth, B indicate somatic growth, C indicate gonadal growth, and D indicate lymphoid tissue growth. So it's also learning for me because this is a new thing. Yes, sometimes NEET-PG asks such high questions and sometimes this basic question. This is the life. Okay, so this was the question. They always ask this one question from neonate. A neonate not pass urine for 20 hours, what you will do? A neonate, what is the wrong with newborn? Which of the following with respect to newborn just after delivery? No, wrong. Immediate breastfeeding, right? As early as possible, within 30 minutes. Close contact with mother. Yes, if it's a normal delivery, baby is well, close contact with the mother. Clean the eye. Yes, from medial to lateral side. Yes, we clean the eye. Warm bath to the newborn. This is not there. We cover the baby with warm sheet or towel, but bath is not recommended immediately after birth. So this is wrong. B is wrong. A, C and D is right. A, C and D is right. Rural area mentioned in question. Okay, which of the following is wrong? They mean to say they have given what in rural area. So rural area also we will give the breastfeed to the mother and clean the eye. Okay, warm bath. Okay. So what is the next choice? Chota doctor. Rural area is written. Okay, I rectify this question. Now, this is universal question. I feel this was the spotter in DNB exam, DNB exit exam. They give the 4 ECG, give the diagnosis. That's all. 4 number for this spotter. In this, your NEET-PG, these 4 ECG. These 4 are the easiest ECG and we almost learn in every class this ECG. This is irregular heart rate. And this ECG indicate that it is atrial fibrillation. Atrial fibrillation. Here you can saw sawtooth pattern. So this is atrial flutter. Flutter. So A is atrial fibrillation. B is narrow QRS complex tachycardia. A child heart rate more than 220 until unless proved otherwise, it has to be SVT, supraventricular tachycardia, and this one wide QRS complex tachycardia. Again, until unless proved otherwise, wide QRS complex tachycardia in a child is VT. So they have given which one is correct, A, B, C, D, like that. A is this, B is this, C is D, D is this. So you need to identify. Again, I would say simple question. This was also simple question, but we never discuss growth curve of different lymphoid gonads. But it's simple now, obvious. This is gonad growth after 10 years. Brain growth is maximum in first 2 years. Somatic growth is gradual and lymphatic growth. This is the things. Now you can help me. What is the exact language for this question? I never get this correct question. Somebody says irregular pulse with no sign of hemodynamic compromise. If there is a no sign of hemodynamic compromise, then we will not give shock to the patient. Okay, the image of atrial fibrillation was seen, but fibrillation will not respond to adenosine. So this is not there. But if no sign of hemodynamic compromise, we do not shock the patient. So one thing may be missing. Either there are sign of hemodynamic compromise or its ECG is not of atrial fibrillation. I want the correct answer, correct options from you. Anybody help me in this question? Otherwise, if I need to answer, I will do the cardio version. Atrial fibrillation, we do the cardio version in this question. Yeah, few more questions are there. One question in celiac disease, in which the diagnostic test, initial diagnostic test is anti-TTG. Anti-TTG. Yes, sometime we do endomysial antibody also, EMA, but initial test is this. Gold standard for diagnostic is biopsy. One thing you should remember, what are the HLA associated with celiac disease? HLA, DQ8 and DQ2. We need always biopsy, but circumstances biopsy is not needed if patient is having 10 times, more than 10 times level of TTG antibody, endomysial antibody is present, and patient is having HLA DQ8 or DQ2, then we no need biopsy. Else, for celiac disease, every time we need a biopsy. But this question was this, which investigation we want to do initially? Yes, it is TTG. Then Lesch-Nyhan syndrome. Again, it's a repeat question. 2-3 times comes in previous NEET-PG. NEET-PG. Characteristic feature of Lesch-Nyhan syndrome is self-mutilation, or we can say self-destructive behavior. Patient harm himself. Initial stage, bite nails, then pulp of the finger, sometime whole finger is amputated. Okay, self mutilation. And Lesch-Nyhan syndrome is due to deficiency of HPGRT enzyme. Then NEET-PG and INI-CET favorite question, galactosemia. Galactosemia. If only cataract is there, this is the deficiency of galactokinase. If you will have cataract and jaundice both, uridyl transferase. So this question diagnosis was uridyl transferase. Simple. Then they show the Turner syndrome karyotype. Because your time is precious, okay, because you want to learn just question, want to know the correct answer, so that's why I'm not showing the question. This karyotype belong to which syndrome? You all know Turner syndrome is 45x0. In your question, at sex chromosome they are giving only X chromosome, second X or Y is absent. This karyotype belong to Turner syndrome. So Turner syndrome, pyloric stenosis, 2 question on pyloric stenosis, then celiac disease, Lesch-Nyhan syndrome, ECG arrhythmia, rickets question. These all are simple question, my friend. You have to answer all these questions, and I am hoping you have answered those questions. Yes, parvovirus leads to aplastic crisis. This was the question. Features of parvovirus. Other feature, parvovirus causes slabbed cheek appearance. Timing of surgery or cleft lip they ask, or cleft palate they ask. Still I am not, probably you have different, few people are very certain, sir cleft lip tha 3 month, and few are very certain cleft palate tha. Cleft palate surgery 9 to 12 month before first birthday. Not exact time is mentioned anywhere. 9 to 12 month we go for cleft palate surgery, and cleft lip surgery 3 month of age. 3 month of age. Okay, so investigation of choice for posterior urethral wall, it's not USG. It's not USG. Both cleft lip and palate. So cleft lip at 3 month, palate as 9 to 12 month. Not USG. MCU, micturating cyst urethrogram, or you can say voiding cyst urethrogram, whatever is the investigation of choice for posterior urethral wall. I hope you have done best with your effort in this exam. Yes, exam is gone. This is life. Okay, so just 1 or 2 days discuss the question. What next? Hoping for best result. Yes, what I've got written for you is there. Okay, if you want your rank, if your rank is little bit behind, God want that you should do PG in that rank only. That is written there. That is written. By chance, any chance you have not get good rank or not selected, trust God. He has some other plan for you. Probably next year you will get good branch and good college of your choice. So you have done your work. You have done your work. Now it's up to God what result God will give you. This is the time. Relax with your family. Don't think anything. Don't think about result. Just 7 days, 10 days. Relax with your family. That is the best time you give to your family, because your family is praying for you during your exam time. This is the time. Give to your family. Hoping for best result. Leave it to God. Thank you. Bye bye. Keep reading. Keep reading. Thank you.